Hello everybody, today we're going to be talking about fetal development, basically how the baby develops throughout the 9 months of pregnancy. During pregnancy, doctors will monitor how the baby is developing using ultrasounds, sometimes called sonograms. And basically what happens is the doctor will use a wand, or ultrasound technician will use a wand, and they'll rub that across the mother's abdomen, and sound waves will produce a picture image. You can now get a 3D ultrasound or the traditional 2D ultrasound. On the left is the 3D ultrasound at 9 weeks, and on the right is the traditional 2D ultrasound at 9 weeks as well. Both are very useful for the doctor to be able to get information about how the baby's developing. The traditional 2D ultrasound is they're able to look a lot at the baby's internal structures and organs, make sure things are developing correctly. They can estimate how much fluid is in the amniotic sac. They can look at the length of the baby and estimate about how much they weigh. The 3D ultrasound is good for looking at the baby's face, at the outer surface of their skin. They can look for facial abnormalities that might be birth defects that are developing, and so they have a lot of information there. And plus 3D ultrasounds are great for the parents because they can see a little bit more of what the baby looks like. These images, especially the traditional ultrasound, always remind me of an old Friends episode where Ross and Rachel are at the doctor's office and they're doing the ultrasound. And Rachel, after the doctor leaves, just starts crying. And Ross is like, "What's wrong?" And she says, "I'm going to be a terrible mother. I can't even see my baby in this." And it is harder for parents to see what is much detail in that traditional ultrasound. Usually ultrasound technicians are really good at showing you what they're looking at and talking about it as you go through the ultrasound. But ultrasounds can definitely be an exciting time for the parents. Here's another 3D ultrasound. This is at 17 weeks. I've heard of a lot of people who look at their 3D ultrasound and then after the baby's born, they say the baby looks just like that. Sometimes they're not quite as clear, depending on if the placenta is close. That tissue can kind of interfere with the image as well. So let's talk about the development of the baby through the 9 months. It all starts with conception. The sperm and egg will meet in the fallopian tube, and so you'll have that fertilized egg that will travel through the fallopian tube to the uterus. This picture is 32 hours after conception. Basically, you have just that ball of cells as it's quickly multiplying. The size of that ball of cells is about the top of the size of a straight pin, of the head of a straight pin. So very tiny as it's traveling through the fallopian tubes. That ball of cells will travel to the fallopian tube, like I said, and it's going to implant itself in the lining of the uterus where it will start to develop into the baby. This picture is at 6 weeks after conception, and it was taken in 1972 after a surgery for an ectopic pregnancy. An ectopic pregnancy is when instead of that ball of cells going to the uterus and implanting itself in the lining of the uterus, it actually will implant itself in the fallopian tubes, which is really dangerous because there's not enough room for the baby to actually develop there. So if it's an ectopic pregnancy, the doctor would have to do surgery to remove the fetus because it wouldn't be a viable pregnancy, and it could endanger the mother as well. So this picture was taken after a surgery, and you can see how small the baby is in comparison to the fingers there, but it's still in the amniotic sac. The dark spot in the center is the internal organs, probably the heart that is starting to develop, and so it's kind of interesting just to see what the baby looks like at that 6-week point. This picture is 4 weeks after conception, and the baby really looks kind of like a little tadpole. You can see very major organs are starting to develop. The brain is there. The eye is starting to develop. You can see the yellow area is the spinal cord. And basically, the spinal cord is developing really quickly. And so it's, at this point, looking a lot like a little tadpole. And then on the left side, you can see the placenta and the umbilical cord as well. The red in the picture, you can see that the blood supply is starting to form. And at this point, the baby's about 1/6 of an inch long, so it's still very tiny. And like I said, lots of major organs are developing. The kidneys, the liver, the intestines are all starting to take shape. And at this point, the mother may not even know she's pregnant. It's very close to the point where she would be possibly missing her period and starting to wonder if that's the case. The embryo will produce a hormone that stops the mother's menstrual cycle. And depending on when she gets pregnant in the menstrual cycle, that's usually up to 4 weeks after conception. And that hormone is actually what pregnancy tests are looking for. So the longer it's been since your missed period, the more of that hormone that is in the body, because it doubles every 24 hours. And so the more likely that a pregnancy test will pick up that hormone really quickly, and you get a positive test a lot faster. Closer to the time of being close to the missed period, you may not have as much of that hormone in your body, so it may take a little longer for this test to register sometimes. 5 weeks after conception, the placenta has started to function, so it's starting to take the nutrients and oxygen from the mother's body and pass it to the baby so it can use those nutrients and oxygen to develop. And then any waste the baby has will go back through the umbilical cord and placenta so the mother's body can get rid of that. The spine and spinal cord grow really quickly, and so that is why it gives it an appearance of a tail. Once the rest of the body catches up, then that tail appearance will disappear, and it won't look as much like a little tadpole. At 21 days, the baby's heart starts beating, and so then you have the blood flow through the body. This picture is at 7 weeks. You can see facial features are starting to become more visible. You have a little black spot where the eye is, you can see a little bit of curve for the nose, and so they're really starting to take form. Muscle systems are starting to develop, so they are giving way so that the baby's not quite so transparent that you can see all of the organs. And you still see some, but with those muscle systems developing, it'll start to look a little more human. The baby starts practicing moving. It has a lot of room because it's still very small, so the mother isn't feeling that movement yet, but the baby can move very freely in the amniotic sac. The bottom picture is at 8 weeks after conception. The baby is now about half an inch long at that 8-week mark. It's moving very gracefully. Again, it still has a lot of room. Arms and legs are lengthening, and you can start to see fingers. So you can see on that bottom picture, the arms and the legs, the fingers and toes are starting to fill in. So it is losing that tail that it had before. At 10 weeks, the heart is almost completely developed, and you have the tiny teeth buds that are forming in their gums, so that after they're born, when they start teething, those buds are already there at 10 weeks after conception. At 12 weeks, the vocal cords are complete, and so the baby, like any of the other systems, starts to use it to be able to strengthen the vocal cords for when it's born and it can actually cry. So they say the baby actually cries silently to help strengthen those vocal cords. The brain is fully formed, and they say the baby can actually feel pain at that 12-week mark. It can suck its thumb, So sometimes you'll catch that on ultrasound. It's starting to look a little more human, and seeing it actually suck its thumb is also another way to make it feel more real. Their eyelids develop and they cover the eyes, and they're going to stay closed until about the 7th month. And that just helps as the optic nerve is developing to protect the optic nerve from the amniotic fluid. This bottom picture, you can see the baby sucking his thumb. Again, the top picture, you can see the eyelid is there and it's closed to help protect the baby's eye and optic nerve. At 14 months, their muscles are lengthening. It's possible now that because they're getting larger, the mother is going to soon start feeling the first flutters of movement from the baby. Typically, first movement, the mother will feel somewhere between 16 and 22 weeks of pregnancy. And part of that depends on the pregnancy. If it's a first pregnancy, sometimes it's later. Because the baby's still really small. So it's a lighter feeling of a movement that the mother would feel. So sometimes then for a second pregnancy or a third pregnancy, mom has already felt that and she knows what she's looking for. So sometimes she'll be a little more sensitive and feel that movement a little sooner. At 15 weeks, they have adult taste buds, and they say they may actually be able to taste their mother's food. So preparing their taste buds for the types of food that they'll be eating after they're born. At 16 weeks, they're about 5.5 inches tall. They only weigh about 6 ounces though, so they're still very small. Their hair starts to develop, so you can see the eyebrows and the eyelashes and a real fine hair will start to appear. They're moving more. They're strengthening their muscles, so their hands, they can start to grasp things. They can kick, they can somersault, and so as they're getting larger, their mother may be able to start feeling this at 16 weeks or within the next few weeks. Second trimester, we have 20 weeks. They say the baby can hear and recognize the mom's voice. And so I've seen videos before of after the baby's born, you have the baby laying on the doctor's table, and the doctor's on one side and the mom's on the other side, and they both say its name, and the baby always turns to the mom. They've been hearing that voice and they recognize it and they know who their mom is. Fingernails and fingerprints will appear. So the bottom picture, you can kind of see the whites on the tips of his fingers. That's his fingernails are starting to appear there. Their sex organs are visible, so now during an ultrasound, the doctor can determine if the baby is a boy or girl. And so usually there's an ultrasound that is scheduled for about that 20-week mark, and parents can find out if they want to, if it's a boy or girl. And that's it's a longer ultrasound, but it's a good time for the doctor to be able to measure the limbs of the baby, make sure it's growing, get an estimate of how tall it is, how much it weighs. They can also do kind of a cross-section and see the baby's organs as they're developing, just to make sure everything's on the right track. And then third trimester, we have 24 weeks. The fetus is covered with a fine hair called lanugo, and it's just a real fine peach fuzz hair that's all over their body. That helps protect their skin from the amniotic fluid. And typically, a baby that's born full term, that most of that is gone by the time they're born. Sometimes they'll have a little bit of that real fine hair left, but usually, again, that falls out and goes away after they're born. If a baby's born premature, a lot of times you'll see a lot more of that lanugo still remaining on their body. The skin is also protected by a white waxy substance called vernix. If you look at this picture in the baby's eyebrows, it seems kind of thicker. You can see a little bit of white there. That's the vernix in the picture. At this point, the baby's lungs are developed, and so they're going to start to practice breathing movements. And to practice, they're breathing in the amniotic fluid, and that's not to get oxygen, it's just to help strengthen the lungs. So they're breathing in that fluid to strengthen the lungs, but they're actually getting their oxygen through the placenta from the mom. At 32 weeks, the baby's kind of running out of room. He's getting bigger, and so he's kind of preparing to be able to be born. And so they're sleeping a lot more. Typically, they say baby sleeps about 90 to 95% of the day. Sometimes they say they're dreaming. What they're dreaming about, not sure. But again, developing in a lot more and ready to be able to survive life outside the uterus very soon. 38 to 40 weeks is considered a full-term baby. At 38 weeks, the baby is ready to be born, even though it's about 2 weeks before their due date. Typically, babies are not born on their due date. It's very almost unlikely that they would be born then, but that gives that estimate of about when they should be coming. Anything before 38 weeks, they are considered premature. But the closer they are, the more likely they are to have their organs developed and be more ready for life outside. Typical babies weigh around 7 pounds. Sometimes you'll see 6, 7, 8 pound babies or more. At birth, the placenta is no longer needed. So after the baby is born, the placenta will detach from the side of the uterus, and then the mother will have to deliver that also. The umbilical cord stops working when the baby takes its first breath, because again, the baby no longer needs to be attached to mom and through that umbilical cord to get their oxygen supply. And so since the baby has been breathing in the amniotic fluid to help strengthen their lungs, they have to make a change to be able to actually breathe in air. So when they take their first breath, the heart and the arteries will force blood to travel to their lungs to help dry out the lungs and allow them to actually breathe in oxygen once they're born. So that's what the baby goes through in that 40 weeks of pregnancy. And now they're ready for birth and to be born in life outside of the uterus. And we'll be talking soon about the process of labor and delivery and how the baby gets here. If you have any questions on how the baby develops through the 40 weeks of pregnancy, please let me know, and I hope you have a wonderful day.